Bismillahirrahmanirrahim. I'm Dr. Mohibullah Wazir, and the topic is portal hypertension and its effects in the body. Look, portal hypertension is the disease in which the portal vein is being obstructed due to some reason, for example, liver cirrhosis or thrombosis or any mass outside compressing over the portal vein. What happens that the blood flow from the portal vein to the liver is being reduced, and the points where there is the portosystemic anastomosis, these points are also called as the collateral channels. For example, in the lower end of esophagus, if there is obstruction to the portal vein, the blood gets accumulated in the portal vein, and the portal vein gets dilated and full with the blood, and the pressure inside, the blood pressure inside the portal vein increases, which we call it portal hypertension. Now, when the portal vein is obstructed, all the veins that drain into the portal vein, they also will get dilated. What will be the sites? What will the parts? Now, the collateral channels, the blood from the portal vein is then transmitted through the collateral channels. That is, for example, in the urine of esophagus, in and then in the paraumbilical veins and then in the anal veins. But note the part that these collateral channels, they are unable to to return the whole of the blood that is being drained by the portal vein itself. That's why the portal hypertension is not being decreased by this collateral, and that's why in portal hypertension we give the beta blocker drugs. Now, what will be the effects of the portal hypertension? Number one, okay, the lower end of esophagus is being drained into the portal vein. So these veins over here, the blood will also accumulate over here, and there will be dilated veins in the lower end of the esophagus, which we call it as esophageal varices. Then at the lower end of the anal canal, there is also portosystemic connection. So these veins also get dilated, so which we call it as hemorrhoids. And then that the splenic vein, it drains into the portal vein. That's why these veins blood get also accumulated into these, and the spleen is being enlarged because of accumulation of blood in it, and that's we call it as splenomegaly, or also called as congestive splenomegaly. And then the whole of the intestine, except the some parts, the blood is being drained from this intestine to the portal vein, and then there is portal obstruction. The blood also accumulates in the wall of the intestine, and ultimately from the oedematous wall of the intestine, the blood will ooze into the peritoneal cavity, which we call it as ascites. Ascites is because the blood oozes from the wall of the intestine because of the congestion. And then you already know that the paraumbilical veins, which also drain connected to the portal vein, so these paraumbilical veins also get dilated, and that is being called as caput medusae. And this way, the signs of the portal hypertension were the esophageal varices, the hemorrhoids, the splenomegaly, ascites, and caput medusae. These will be the signs of the portal hypertension, and then the effects you will see in the patients. Okay, thank you very much.